welcome all of you to this first inaugural MS Register webinar. Thanks for joining us. There may be some technical gremlins as we go along, and hopefully you can all hear and see us all okay. I will share a slide first, just so you can have something to look at other than me as I'm talking, so bear with me. So there you can see the fabulous UKMS Register crew. I think in case you encounter anyone when we're out and about and we can all go back in the world, you'll recognize the team. And our speakers are, I'll come to in a minute. But as I say, thanks for joining. Please note, we're recording this Zoom as we have planned to share it in a few weeks with all the UKMS Register participants. We're celebrating 10 years of the UKMS Register this year, and some of you who are here with us today have been with us since the outset, and I just want to say a huge thank you to all of you. 10 years of responding to our questionnaires and everything that we've asked you to do over the years is a real huge commitment, and we really appreciate that, so thank you. Also, an additional big thank you to the MS Register's Brainstormers group, who are helping us develop and improve all aspects of the Register, and their input is also hugely valuable. To show our gratitude to all of you, we thought we would organise this webinar so that you can see and hear how contributing your data has directly made a difference to MS research, and specifically for this event, research around COVID. Should this be a success, we plan to do a few more in the future, and as a thank you to those of you that go above and beyond, as a thank you for those of you that go above and beyond for your contributions to the Register. You may have noticed that we're encouraging to ask questions as we go along, and you can see we have a link. Hopefully this will work if I move on here. There's a link here that you should have received in your emails as well. If you visit that on a smartphone or a device, if you're on a computer, you can type questions directly into that, and we may have a few more interactive things as we go along, really. So if you put some questions there, hopefully the panel will be able to address some of them, not all of them, at the end of this. Click on the link in the chat, use the QR code to get there. We won't answer anything, or the panel won't answer anything specific related to your MS or condition, but general questions that can actually will do the best that they can to answer them. Today, we have 3 members of the COVID-19 group that were formed at the start of the pandemic to address the many unknowns of how a COVID-19 pandemic would affect people with MS. So we're delighted to welcome our three neurologists. Dr. Afagh Garjani is a clinical research fellow at the University of Nottingham. Professor Richard Nicholas is the UK Multiple Sclerosis Register Clinical Lead based at Imperial College London, and Dr. Nikos Evangelou, also from Nottingham University, has been working with the Register right from the outset. So we're delighted to have the 3 speakers, and they're going to cover COVID-19 data collection and what we did effectively, COVID impact and vaccination, and going forward, the future and treatments. And then we'll have a bit of a panel discussion based on the questionnaires that have come in. So I hope that's okay for everyone. I hope we're not having too many technical gremlins. And at that point, I will hand over to Dr. Garjani.
Hello, good evening. I'm just going to share hopefully you can see my slides.
Yes, we can see them.
Perfect, thank you. Hi everyone. I'm Afagh. I'm a fellow at University of Nottingham, and I'm just going to go through the studies we've done with your participation and your help during the COVID-19 pandemic. So first of all, the things that we tried to cover in the studies, and you've received many questionnaires from us, and thank you again for completing them and responding to them. And things have been changing very fast during the COVID-19 pandemic. There were questions and concerns about the severity of disease in people who have MS, whether they are at increased risk of catching the infection, and how different aspects of their MS, like treatments or levels of physical disability or things like mental health and other factors can affect COVID and vice versa. So I'm just going to go through a few studies that we did and just share the findings with you. So this is one of the very first papers we published at the very beginning of the pandemic. So this covers the first year of the pandemic from March 2020 to March 2021. And an amazing number of almost 8,000 people with MS responded to our questionnaires. We followed them up throughout the year and even then after, but in 1 year, about 14% of people with MS had COVID-19 and about 2% were hospitalized. And then when we compared this to a control group, so we also asked some people who didn't have MS whether they had developed COVID or not. We found that people with MS are not more likely to get the infection than people who don't have MS, which was reassuring. So next, we wanted to have a closer look at those who get COVID and see how that affects their MS symptoms. So what we found is that 57% of people with MS who get the infection experience some form of exacerbation of their MS symptoms. So most patients after getting COVID, they experience worsening of their old MS symptoms. So the symptoms that they had before, they might reappear or just get worse following the infection. And this is not a new thing. We know that with MS, if you get an infection, if you have fever, it is likely that your MS symptoms might get worse. So about half of the patients reported that their MS symptoms got worse after COVID, and 20% reported that they developed some new symptoms following the infection. And what we also found that for people who need a disease-modifying drug, if they were taking it, they had a lower chance of experiencing new MS symptoms after their COVID. And also people who had higher levels of physical disabilities, they were more likely to experience worsening of their MS symptoms following the infection. So this was the effect of COVID on MS symptoms, and then we carried on to look at recovery from the infection in people with MS. And we followed 571 people with MS who had COVID through time, and these were non-hospitalized patients. So this is for people who have not been admitted to the hospital because of their COVID. And after a month, 30% of people, so 3 out of 10 people, had not fully recovered from the symptoms of infection. And after 3 months, 12% of people had not fully recovered from the infection. So basically, most patients eventually recovered from COVID. However, similar studies have been done in the general population among people who don't necessarily have MS, and the rate of what we call long COVID seems to be lower in the general population. So it might be that people with MS, if they get COVID, they're more likely to experience the symptoms for a longer period. And it might be because there are overlapping symptoms between COVID and MS, like fatigue or pain. So for some groups of people with MS, it took longer to recover from COVID. Women were more likely to take longer to recover. People who had higher levels of physical disability before getting COVID, and also people who had anxiety or depression before getting COVID were more likely to recover later than sooner. So another part that we did, we looked at the changes in mental health and mental well-being in people with MS, and I've just put some bullet points of our main findings. So at the start of the pandemic, this is in the first 3-4 months of the pandemic, when we asked people MS about their levels of anxiety and depression, we noticed that actually the levels had not changed compared to the levels before the pandemic. So you probably already know that the register has been collecting data on anxiety and depression levels for a very long time, 10 years, I guess. So we compared the levels after the pandemic had started to the levels that we had before the pandemic. And to our surprise, we really did not see any change in these levels. And we think that it might be because, so there are some discussions that people with MS, because they're dealing with long-term condition, they might be more resilient than the general population. And the reason we were surprised about this, because actually studies were published saying that the levels of stress in the general population had increased significantly. So, and the other thing, we thought it might be what we call the ceiling effect. So what we also found is that although the levels of anxiety, depression had not changed after the pandemic, people with MS were still more likely to have anxiety or depression than people who did not have MS, and this had not changed. So they were still at increased risk of having anxiety or depression. So maybe the levels of anxiety or depression were so high that there was no place to go further up. So there were a couple of theories about this, and then one finding that really caught our attention, it was that people who had anxiety or depression had a higher chance of experiencing worsening of their MS symptoms during the pandemic, and this was regardless of whether they had the infection or not. So if someone had anxiety or depression, they were likely to experience that their MS has got a bit worse during the pandemic. And this risk was even higher than the risk of worsening of MS symptoms following the infection. So yes, we had COVID, but we think that mental health is an important issue in MS generally, and it continues to be the case during a pandemic, and we can clearly see its effects on physical health. So these are the studies that we've done as part of the register. We've done, so following these, we've worked with NHS England as well to look at people who take disease modifying drugs in England, and we thought is relevant to discuss some of the findings as well here. So this is a graph. It seems complicated. I'll take you through the graph step by step. So in the horizontal axis here, you can see the months. So it starts from March 2020, the start of the pandemic, and it goes until December 2021. Okay, so the black line here, without any shades around it, shows the rate of infection, COVID-19, in the general population of England. So as you can see, for example, at the start of the pandemic, it was low, and it goes around Christmas time in 2020. Then there was the first wave, and then again, about the same time, if you remember, vaccination started, so the levels of infection dropped and then increased again in the summer of 2021, and then increased again in Christmas time in 2021. So this is the general population. So the blue line with the shaded area around it represents the rate of infection in people on a specific disease-modifying drug called dimethyl fumarate, or some of you might know it as Tecfidera. And this is just an example of one of the DMTs. So what you can see here is that it follows the pattern of the general population. People on this drug, especially during the peaks of the pandemic, might have fewer infections, probably because they're more cautious than the average person in the general population. And then once vaccination started and was completed, so most patients got vaccinated, again, it followed the same pattern. So it shows that people who were on this disease-modifying drug, dimethyl fumarate or Tecfidera, responded to the vaccine basically the same as the general population. So moving on to another disease-modifying drug, the beta interferons, and these are the self-injectable ones that you get. And again, the black line without the shade is the general population. The rate shows the rate of infection in the general population, and the colored line with the shaded area is the rate of infection in people who use beta interferons. And you can see that again, it follows the same pattern before and after vaccination. Okay, so this is much lower than the general population, but again, it stays low after vaccination. So there were two drugs that didn't really follow the same pattern. So they didn't say the rate of infection didn't stay low after vaccination. One of them was fingolimod. So here you can see before vaccination, around this time, the rate is similar or lower than the general population, but once vaccination started, the rate just goes a bit higher, okay? And then the other one, so you might know fingolimod as Gilenya. And then the other one is ocrelizumab. Again, the other name, the brand name would be Ocrevus that is being used. Again, as you can see, before the pandemic, before vaccination, it was almost the rates were similar to the general population. And once people had been vaccinated, the risk of infection in this population just increases and goes above the general population. So these findings might indicate that people on these two drugs might be at slightly increased risk of getting COVID, even if they are vaccinated. So it doesn't mean that vaccination does not prevent infection in these patients, but it just means that it might be less effective than other disease-modifying drugs, and I'm sure we'll have further discussions about this. So that's my presentation. I'll hand over to Richard, Dr. Nicholas. Stop sharing my screen. Thank you.
Hello, I don't seem to be able to start my video. Thank you. And I'll share my screen. Sorry about this. Hopefully, can you see that?
Yep.
Yeah, thanks. Thank you for coming. Thank you very much, Afagh. It's good to see some new data. We always like to see new information. I'm going to talk a little bit, sort of a slightly running on from that into a few other issues. Again, look at the effect of COVID. I mean, you've talked about what the rate of infections in various treatments. So people on the MS register were part of a global initiative, which is really over about 32 countries, 5,000 people with a significant rates of confirmed COVID, because of course 900 was suspected at the beginning of this pandemic. We didn't quite know, and we looked at how severe COVID was. So I mean, we'll probably talk about this in a bit later, is how bad is COVID now, or what are we seeing? It seems to have changed over the lifetime of the illness. And this was at the beginning, and it was graded really quite severely as either not severe, ICU admission, hospitalization, or using ventilation, or death. So quite severe. So what was features that were risks for people with MS was male gender, older age, having progressive MS, and higher disabilities. That's with the more severe course. Again, comorbidities, which we know from lots of other things, which are high BMI, steroid treatment were associated with more severe illness, and actually current smokers were at greater risk of death. But what we looked at was this is slightly complicated graph, which I'll take you through, which was the risk of having going into intensive care or not, or dying or not. And this is the individual treatments, and the baseline treatment was considered to be glatiramer, which is in the middle, glatiramer acetate, Brabio, as I say, if anyone's on that at the moment. So that was considered to be the baseline. And we looked at the risk of death, ICU admission, and mainly this is where the sort of data started to come about, ocrelizumab, which some people may be on, Ocrevus, but also rituximab or Rituxan, which is used a lot in Sweden. So a lot of this data comes from Swedish, but what we see is there is a higher risk from being on ocrelizumab or a B-cell blockade in terms of coming into intensive care and mortality. So that data has been updated. So this constantly looking at this, because obviously this data was at the beginning of the pandemic, and the question is how relevant is that now? So it's something that we continue to learn from, and I think we're honestly all desperately capturing data from any sources we can to try and understand the risk as it changes with the disease. So a little bit more about Afagh has talked about the impact of lockdown and our findings about mood. But what we've been trying to do, this is just to tell you what we've been doing with the questionnaires that you fill out, which is one of the MSI's 29 questionnaire, which hopefully you've seen and done. and it's divided into 29 questions, 20 motor ones and 20 psychological ones. And these measures are graded. I'm sure if people answer them, you'll see that they go from 1 to 2 up to 5, or 1 to up to 4. And one of the questions we have is, what does little changes in? So does the same as change from 1 to 2 mean the same as a change from 4 to 5? So going from no symptoms to mild symptoms, or from significant symptoms to very, very significant symptoms. So what's actually important? And we've been looking at our data just to try and start to understand how we can learn more about each question that people answer. So this is slightly complicated questions. So this is each question on the bottom from the motor score from the MSIS 29. And what it looks at in the first column, sorry, it's a very complicated picture, is the change in the pre to the first wave of the pandemic. And then it's from the first wave to the second wave, and then from the second wave to the third wave. So what we see in the first wave, actually over the period of all these 20 questions, only 4 of the questions were actually important. And that was questions about balance, about social leisure, about being stuck at home, and work activities. So unsurprisingly, when the first pandemic came about, there was an increase in people stuck at home. So it's fairly obvious what makes a difference about it. And then as the first pandemic was released, or these released, we worked out that actually therefore people were less stuck at home. And then when we locked down again, we were re-stuck at home. Again, social and leisure was affected by this quite significantly, and work activities. But the only thing that was actually related, maybe because whether people were worsening in terms of their MS, was the balance was affected. So there were some impacts actually probably on MS itself. Again, we use this approach to look at the mental health questions, because again, we've got 9, these are all the questions from the HADS depression score, and each question you can see what they are. But again, only 4 questions were important. And one, surprisingly enough, was something awful is about to happen. So that question went up, and then it went down, and then went not so up again at the end in the second lockdown. Again, people feeling a bit more slowed down, and people's appearance affected, but also humor was affected. So I'm not sure. So the question is that we're starting to dissect into the little details of what's actually happening. So all this information that you give each individual question helps take us further forward. So we're still working on this data, and we keep recording it sequentially, but it sort of starts to get down to the granularity of what's actually happening to people individually. And lastly, I was going to talk a bit about vaccination. I think vaccination in MS has been controversial. So we previously there's arguments about vaccination, but actually studies haven't shown that vaccines drive MS relapses in general. And we actually looked at the willingness of people to actually have vaccines. And this is actually not our study. It's a study where we're part of this pit here in the UK. It was a meta-analysis looking at the willingness and the hesitancy and unwillingness and significant impairments to having vaccinations. And we looked at ours, which is so that basically 94% of people were willing to have the vaccine, which was actually in the UK 6% unwilling, but basically was higher than the general population. So despite that sort of history, overall people with MS seem to be very keen to have that. And looking at the reasons for not getting the vaccine, and remember we did this in February 2021, which was at the beginning. Well, there was a safety concern, and I think that's something that we all shared, and a lack of information, which was a real problem at the beginning, and I'm sure we continue to share that. But if enough information was provided, if people were more likely to get the vaccine, and actually people who said they wouldn't get the vaccine initially, when we followed up at about 6 months later, 27% of people had said no, actually had the vaccine, went on to actually have the vaccine. So a very good uptake, and I'm sure we can talk more about it, but I just wanted to show something about us, the data that you're offering. We're collaborating worldwide. It's helping us answer those questions and looking at these new ways of studying data, and also trying to ask relevant questions to all of you. And thank you.
Over at Nikos.
I don't want to give the impression that Nikos is not well organized with lots of graphs like Afagh or Richard, but having seen so many useful information, my role is try to provide some sort of summary. Where do we go from here? What's going to happen? And probably, my role is to start encouraging some of the questions and ask questions to Richard and Afagh and have a bit of a conversation. It is nice that we're 30-40 people here, so we can have an interesting conversation. So what do we think? I'll not try to be provocative. Usually this is the job of Richard. What do we think that is going to happen with COVID? Nobody knows. So we're doing very well, and we have been reassured previously a few times that I remember when the first lockdown came along and my wife was asking me, when do you think the end of the lockdown will happen? I was saying, I don't know, in 3 weeks' time, and it will be all of it. As we are by nature optimistic, and every time things are going all right, we're optimistic and we hope that we'll escape. But despite, of course, at the moment having to face major financial crisis with cost of living and major wars in Ukraine, and as a result, this has taken a bit of a secondary place in our thinking. There is a concern that we might have another variant, and variants of concern. What the scientists, the epidemiologists, and the virologists are telling us. You remember, we read on the news all the time. There are a number of them that people are looking, and every so often one is spreading and is overtaking the other. And there is always a possibility that although we are all right at the moment, there might be another one that will, who knows, are we going to go to another lockdown? Now, it's much more likely to get to lockdowns than before. Until a couple of years ago, we didn't know what lockdown was. When Italy or China closed down, I think we thought that this was all crazy, but what are we going to do about it? But now this is what happens. So I think there is understandably a COVID fatigue from all of us. We want to forget it, but I'm not certain that we are allowed to forget it as easily. Then the impact. I think our audience can tell us more about the impact, because we have all been impacted by COVID, but the impact continues, and depending on our state of health, depending on our philosophy of life and our underlying conditions, the society might have opened, but there's still widespread infection rate and dissemination, and although overall Omicron variant and the various subvariants appear to be milder than the Delta, we all have friends and family that sometimes they're going down, and they're going down really badly, with difficult to recover. One of our nurses at our unit is pretty bad at the moment, despite being a healthy individual without any underlying conditions. And we all have talked to people, and they have tell us how long does it take to recover. And actually, sadly, a proportion of us, we have had it. And we know that it is not a simple cold that will go away over the next few days. So this is what do I, what people predict that it is going to happen. Afagh and show us also that, yes, you can get COVID, and with Richard's data, we are all reassured that the majority of the patients, they will do all right. They will stay at home. They might have a bit of a rough time, but that they will make it to come to the hospital, proportion that still ends up in the intensive therapy unit, but the recovery takes a long time. And if a normal bladder infection, gets us back for a couple of weeks, COVID with sometimes affecting the breathing will affect the recovery for weeks and weeks. And we have shown that there is a significantly higher proportion of people with long COVID. There is a big of a question: what is the significance in a year's time or a couple of years' time? I don't think that we need to be panicking, because we need to remain positive and we need to take our way forward and lead. But it is still there. MS services like the NHS is in a state. And I think it's in a state, we know that, we were in a state even before the pandemic, and now because things have deteriorated significantly. And I don't think that there is a hospital that has not felt it. I don't think there is a person with multiple sclerosis that has not felt that, communication with the center is not as good. And this is not going to get any better. It will continue to create difficulties. And I think the contribution of the MS registry in collecting the experiences of people with multiple sclerosis is invaluable, trying to identify what are the hotspots and what is the real impact this has in our lives, in the population of multiple sclerosis. So it is different to be moaning about the poor services that we get, but it's actually data that might persuade some health authorities, some, I don't know, the minister or the MP, that there is a need in some of the areas. And I know, there are lots of demands on your time about the services that we are using related to multiple sclerosis, how it's affecting us, but they are being used very well. And in terms of, this is the final point, in terms of disease-modifying therapies, Richard has shown us and Afagh has shown us that some of the medications, they have an increased risk of an infection. Some of the medications have an increased risk of, being admitted to hospital. Luckily, this is a small proportion. These are, very effective medications. Each one is there to judge for himself or herself. There are people that have changed medications because of this unpredictability and the increased risk. But we'll have to wait and see. The number of, I'm sure there will be discussions, a number of treatments now when you get COVID, and we are very lucky that some people consider that it is luck that multiple sclerosis patients considered among the groups that will receive the extra treatment for COVID if they get it. And certainly there are many people that we know that have received the treatment and they have had a very mild disease. So one would expect not only the treatments we have at the moment, but the treatments that will come over the next few months, they will be more effective, and hopefully the impact will be less. So I just wanted to finish the formal discussions and the formal presentations, saying that obviously we have done exceptionally well. I think we contributed knowledge regarding COVID internationally. So your data have contributed internationally, and people have recognized that the UK is leading exactly as we are leading, I think, in the epidemiology, in terms of infections of the population globally. I think the MS community we have done very well. We have generated very valuable information, and as a result, we have changed the way we think about COVID. So this was my, intentionally not slided presentation on how do I see COVID affecting us over the next few months and who knows, years.
Thanks, Nikos. That was very good. We have got a few questions that have come up as you've been talking, and thank you everyone who's been going into Slido and putting in the question. And I'll try and pick a couple of them, and I would encourage those that are still listening, if there are other things that you'd like to ask the panel, or if you can vote up some of the questions that are already there, then you can do so. So there is one that's been voted up at the top, and I'm just going to read it out to you guys, and one of you can pick it up if you like. So Alice asks, can high doses of vitamin D help stop catching COVID?
Well, shall I start?
You can start. Why not?
Yeah, I mean, there's been lots of work on this, and so I think vitamin D. I mean, I recommend vitamin D generally because I think it helps your immune system and helps reduce asthma. The actual evidence directly for it to stopping COVID is unclear, I have to say. So I wouldn't push it that it's a treatment or going to prevent it, but I think in general it does help protect you against quite a lot of other things by helping your immune system. So I don't know if anyone agrees or anyone has any.
I mean, Afagh has collected. Afagh, do you have anything from the MS registry that we'll try to publish?
I mean, at the beginning, we looked at the relationships between vitamin D levels and catching COVID. We really didn't find that there is a strong association between that, but then again, I agree with Nikos. We recommend taking vitamin D for many other different reasons. So it won't increase your chance of getting COVID. So if you're taking it for MS itself, if we recommend it, there's no harm.
Thanks for that, both. Una asks, which is better to have as a person with MS, antivirals or monoclonal antibodies? Are we given a choice about which one we can have?
Well, so I saw someone, so I think, I mean, as Nikos has alluded to, and we all know how we approach COVID now is really different. Obviously, we don't, well, I don't know about Nikos, and in fact, we don't limit what DMT treatments we offer anymore. We're quite happy to go with that. And I think everyone has these packs and has the options for the treatments. So we have found the monoclonals to be much more well tolerated in my anecdotal. This is what people are about. I think we've had about 15, 16 people who've had them. And so some people have had some issues and side effects with the tablets. And I mean, there is some general questions out about the tablet medication, how effective they are in general, but certainly the monoclonals is what I would go for. And I do know that certainly in our area, people have been able to choose.
It very much depends. It very much depends on the locality, and we also know that a number of people. There are criteria that being circulated. The criteria can be different in different localities. So they're more effective, of course, if the treatment is given early. But if the people are almost asymptomatic, or with very mild symptoms, things are getting a bit better. A number of people will say, actually, I prefer not to take any medications. I'm doing all right. So I think most of the people consider, exactly like Richard said, that the monoclonals are more effective. It's an infusion. You have to come into hospital. The other is a tablet. So some people will prefer the convenience of a tablet, especially if it is milder. In fact,
yeah. So in Nottingham, I think again, this is from experience seeing a few people who have received the treatments. I think it's based on the severity of symptoms at the time NHS contacts patients. So for more severe symptoms, they tend to go with monoclonals, and if patients have less severe symptoms, go with the antivirals. And for asymptomatic patients, there were a couple of patients who were not offered the treatments at all, which makes sense.
In our area, I have to say, mainly people who've taken the treatment, to be frank, are people who've been on usually Ocrevus, possibly fingolimod, actually have probably not had anyone else go. I mean, as you've said, as we've alluded to, if your symptoms are bad, because you've got to make the decision in the first 5 days. If your symptoms are bad, you just go for it. And that's tended to be people who are on the monoclonal, DMT monoclonals, as I say, but sorry, Ocrevus, and in particular. And so I think if you're not too bad, I mean, a lot of people have had it. I mean, again, I've seen someone already, 2 or 3 people today have had it, and they just had a headache for an hour or so, a couple of a day or something like that, and they moved on. So if you're not really that bad affected, I think that's where the side effects of the antivirals, because obviously if you're less severe, people take the antivirals, and then the side effects of the antivirals seem to be another element that stops people continuing the course.
Another voted up question. Is there a prophylactic infusion that people on ocrelizumab can take in lieu of the ineffective vaccines?
So we are, I don't know what Afagh and Nikos are doing in Nottingham. So I can just say that we're starting to measure antibodies in people who've been on Ocrevus to try and get an understanding of what their immune system has responded, how it's responded, to give us an idea whether they've actually, we're finding a very big range, as we might expect with any treatment, a very big range of responses. So in our area, we can measure an S antibody, which tells us whether you've had the vaccine, and you can measure 1 to N, which is to whether you've had the virus itself. And so we're trying to get data together to try and get an understanding of an individual risk about what we should be doing, how we should be approaching this. I think, Nikos, you've got a paper you're part of with Emma, and
we have collected. I mean, in terms of the antibodies, we know that the medications we mentioned before, and Afagh mentioned about the fingolimod and the ocrelizumab, we know that there is a significant use of antibodies. This is the way medicines work. But on the questions, I am not aware. This is slight hesitation. I'm not aware that the long-term protection medication that has been approved in the States has been approved in the UK yet. So there are some medications that indeed they show promise in offering a long-term protection from infection, and people were considering that this might be an option for people that they are on medication like Ocrevus. But I don't know if this has been approved. It's embarrassing. I don't know.
I don't think it has. Not yet.
Thanks for that. I think one more question, and we'll see if any more pop up in the meantime. This is slightly a tricky one, I appreciate. Is there any evidence that COVID-19 can trigger a relapse?
That's not the controversial. Afagh, tell us the answer.
So as I briefly show with the data, what we have found is that, yes, some patients can experience new symptoms, what we would call a relapse following having the infection, about 20% of people. So it's again not that much different from other infections. So again, with any other infection, there is a chance that people might experience new symptoms. We haven't directly compared it to other infections, but from other studies, other infection, it doesn't seem to be that much different.
I mean, this is just wanted to repeat in slightly different words that we knew it for some time, and the data that actually the MS registry has provided, it seems to be the case, and we have all had the occasional individual patient that they had COVID and then they developed neurological symptoms soon afterwards. If you think that at the moment with the treatments we are giving, we have looked in Nottingham and the risk of a relapse now is probably 1 every 5 years or 6, 7 years. So if you have a COVID and then a couple of weeks later you have a relapse, you cannot prove it, but you have to say that it's most likely associated. The numbers are not great because we have so many people, having caught COVID and and only a proportion, as Afagh said, we have a lapse. So I think it's not nice to get COVID for lots of reasons. This is another one.
That's great. Thank you all three of you, and thanks to everybody who's posted questions in the chat. Unless something urgent comes in at this point, I think we might stop it there. I have opened up 2 more options in the Slido presentation for just to give a rating of whether you enjoyed the lecture that we've done, and if you did, the chances are we're going to do some more. And thanks to the speakers and to all of you for listening to this. And any topics that you'd like to see discussed in this sort of format for the future, because we really would like to sort of tailor these a little bit better to what you did. To what we can from the data from the register and what the experts assembled before you can sort of bring to the field. So thank you once again for your participation, and we'll leave the polls open on Slido for a little bit longer, and thank you all very much. Hope you enjoyed it, and thank you, Nikos, thank you, Afagh, and thank you, Richard, for your time.
Thank you.
Bye, everyone.
Bye.
Bye-bye.
And now the awkward bit, how do we turn it off? Don't forget to join the UKMSregister.org, follow us on Twitter at UKMSregister, or subscribe to our YouTube channel.